You're with eHealth TV, and I'm very pleased this morning to have in the studio Professor Anil Thapliyal, who's the Executive Director and eMental Health Lead for the eMental Health International Collaborative at AUT. Anil, lovely to have you here in the studio. Going to delve a little bit deeper into exactly what is eMental Health. So let's probably start out with that. What is eMental Health? If you can give us a couple of examples, please.
So eMental Health is, in short, is eMental Health services delivered through internet and related technologies. So it's as simple as that, and how we deliver some of those services through digital means.
So Digital Health Week here, we're exactly where we are, has an eMental Health stream this week. So why do you feel this is an important thing for New Zealand?
I think eMental Health needs to be seen not just in a digital context, but also when I look at even a simple things such as phone. Who doesn't carry a phone? And there's been a recent survey done out of UK, and when it looks at what do we use the phone for these days, and the total data points towards the making phone call is the number 11 activity we do from a phone. So there are a lot of other things we do. We do, number one is texting, and then the list goes on from the use of camera to social media to emails to, and so how are we using technology? Whether it be online banking, they are all ahead of making a phone call. So unless we are speaking the people's language, in the environment where people are, and that's what people's day-to-day lives are in terms of the habits or in the way they're communicating and engaging with the, whatever are the priorities for them. But we know what those trends are. So unless we are in that environment where the people are, we're never going to connect with them. So Digital Health Week is more than just about digital, it's about speaking the consumer's language.
It's more, as we would have done in days past, to actually have conversations with in a human context, but basically through a digital means.
Absolutely, and I think one of the things is, Greg, is very important to note, is eMental Health is not a one single thing. It's not about website, it's not about apps. What eMental Health is composite sum of the four, what we call it the four subdomains. So one of them is information provision. So can I get somewhere where I can find legitimate, good, plain English information about mental health? Something which I can understand as a layperson. So that's what we call as information provision. Sometimes I just need that little nudge in my life to get to the right place. I don't need treatment intervention. I don't need things which can sometimes be over-pathologized or clinicalized for me. I'm just going through a bit of a stress because my wife has left me, or maybe I've been made redundant. Whatever that stress is, I just need to go to some place, get the right information, and I'm on my way to well-being and recovery for myself on my own. The second part of the eMental Health is what we call as engagement. So that is intervention with any kind of treatment services or well-being services, and engagement during those engagement, that is treatment intervention, or it could be post-discharge or once the treatment is over. So that is what we call as the engagement component. Then the third component, which is very important, and it's called treatment interventions. So treatment interventions are classified what we call in New Zealand and some of the other Commonwealth countries like Canada and UK, what we call stepped care treatment. So that means if I've got a mild to moderate sort of symptoms of depression or anxiety, I don't need the treatment intervention which will be provided to me if I was hospitalized. So that means ranging from well-being services to something which will be applicable for me in a primary care setting, or to something which will be applicable for me in a hospital setting. So those treatment interventions are more designed around, and they got an evidence base of efficacy that they are effective. And they're the third quadrant. The fourth quadrant, which is very, very important, and let's not underestimate the power of it, and that's called social support. So for example, if I presented myself in emergency department, a colleague of mine who has done a large number of studies in this area, he talks about if he knows your name, which suburb you live in, through the postcode, your employment status, relationship status, and range of other factors which he collects, he can accurately predict how many weeks later you'll be back in ED again. Right now, this is not so much somebody's own guess.
Yes.
This is now it can be quite accurately predicted. So what he did is, from his studies, is also looked at providing some base level interventions around, such as texting. So, dear Greg, we talked about you getting in touch with your friends and sort of getting in touch with them and catching up with them for a coffee, going to the gym, or whatever the little things which the person who is the clinicians in this case, and was the person who's accessing the services such as this. So the thing is, just because we stitch somebody up and send them back home, but if they've gone back to the same dysfunctional environment where there's alcohol, domestic violence, and the range of other factors, it's no wonder people are back in the ED again. So I think, so when we look at the information provision, engagement, treatment interventions, and the social support, that total altogether put together is eMental Health.
I love it. I mean, it's and beautifully packaged in the way that you've described. One of the things around mental health is that we've had so much more publicity, and we're trying to destigmatize the challenges of actually speaking about mental health, which of course means that people have a great deal of passion for it, and there's a wide range of provision of services that are coming into the market. Some of it very well-meaning, some of it very well researched. What are some of the challenges around that? There's a lot of apps that are coming out where people can effectively check their own symptoms and then potentially go on a course of action as a layperson. What are some of the benefits and some of the challenges around that for the general public?
I think we are in the very early stages of this domain development. So I think there are a lot of good Samaritans who are doing out of the goodness of their heart. They're coming up with a range of initiatives, and we need to all support and encourage that. At the same time, there are inherent risks that also come with that. So I'll just start with a fact, Greg, and that is there currently are 327,000 health apps in the world. Yeah. 327,000. 65% of those apps have not been updated for the last 18 months. Yeah. There's been nothing, no content update, nothing, the refreshing of any of the treatment, what they provide. Only 15% of those apps meet what we call the minimum standards. 15%. So if you are the health system commissioner or provider, and even if you want to do innovation in mental health, good luck to you, because you do not know where to start. Which one are those 15%? Yeah. And to me, it's a challenge for the system as to how do we innovate, but also keep whatever we commission is safe and effective for the people who are going to access those treatment services or just well-being services. So I think the challenge is around safety. And the reason I say that, there was a recent study which was published in April 2019 in JAMA. It ranked, it looked at 36 most, the commonly prescribed apps in mental health and addiction treatment in 2 countries, the United States and Australia. Out of those 36 apps, 29 of those app providers were selling the patient's personal data to third-party companies. Yeah. So this is a published study. So now these apps were being prescribed by the doctors. So, but doctors didn't know about that. So whose job is it to do the cybersecurity checks? And how do you even know that was happening in the background? So this is where there are some risks. And so one thing which I may also want to touch upon here is it's a shiny toy syndrome sometimes. We are all excited. My God, there's an app. Have you seen this? And somebody came across something. When people are so excited, all right, and rightly so. I don't want to dampen the excitement which is underpinning how sector is developing. But what is very important to know, to get anything right, it's not a purview of one person, like the scientist who has developed it,
Yep.
or somebody who is a commissioner of a service with the DHP or a PHO or Ministry of Health. Because what we need is more than just a person saying, here's the evidence, this is, look at it, it works. To get the implementation right, Craig, what we need is a combination of factors, and I call it the service users, the people who have got a lived experience with that particular medical condition. They need to be at the core of decision making in co-designing treatment solutions or whatever the intervention solutions look like. If it doesn't work for them and their families, it doesn't work at all. Simple. So we have to look at the lived experience being at the core of whatever we're doing. Number two, of course, we need to look at evidence-based or evidence-informed.
Yeah.
The reason I say that is sometimes to gather evidence-based can take quite a long time.
Yeah.
And sometimes we may not have patients to wait around for 5 years for the RCT to be completed.
Yeah.
So latest international trends are evidence informed. That means if the source of information has come from, say, some of the the best names in this field,
Yeah.
so information is credible enough, and then you work in an iterative manner around some evaluation studies around to validate and efficacy of the tools and products and services. So looking at the efficacy, the scientists. Number three, the commissioners. So that means strategy and the policy people.
Mm-hmm.
They need to be. If they don't know what's out there, then it ain't gonna work. So, and also whatever we do needs to be scalable. It needs to be sustainable. So there is a third component. The fourth component is the people who are prescribing these tools. All right, you as a clinician, I'm not going to start using this amazing icon that's been put into the drop-down menu on your PMS palette, because it ain't gonna happen that way.
Yep.
You know what? We forget the reality of the frontline clinician. They are working under a very high pressure situation. We keep buying innovation, keep throwing it at them. So workforce development I talk about.
Yep.
So unless people understand the value why they're prescribing it, and that is safe and effective, and so then you're more likely to embrace it. So workforce development is the fourth component. And the fifth component, which is the dearest to my heart, has to be the industry. Industry participation. We should not look at the vendors and as some people who have got vested interest and conflict of interest, and we're not going to talk to these major providers of technology.
Mm-hmm.
I think they're all part and parcel of the solution. And the more we see them as allies, the better we are as a nation. Because we can't change the entire ecosystem. There are EMR vendors for the secondary care, the EMR vendors for primary care, the patient portals, and the apps, dime a dozen. Unless we learn how to operate and team together.
Yeah.
So across the 5 components I talked about, it ain't going to work otherwise.
I understand from what you just said there that the solutions of being able to provide eMental health solutions to the general population are incredibly complex. It's a whole organism made up of many moving parts. How do you see the development of eMental health in New Zealand, and what can we expect, or how can we expect it to develop in the future for the benefit of New Zealand?
Well, this is where my excitement is. So one of the biggest innovation, Greg, which has happened in the world of mental health, is it's come out of Zimbabwe, 2004. It was born out of what I call as adversity. Sometimes is the mother of all inventions. So they have got a nation of 14 million people.
Yes.
Only 12 psychiatrists for 14 million.
14 million.
And 12 psychiatrists. So initiative was dreamed up, and which has gone on to become a pioneering movement, where they call it a friendship bench.
Yeah.
Friendship bench. So some of the people like grandmas who who got trained in basic CBT, so that was mainly the exercise of listening.
Yes.
So if I'm sitting, say somebody sitting on a friendship bench, I could just don't need an appointment, I just can rock up and talk. So if you look at the core elements of the friendship bench,
Sure.
it's about listening.
Mm-hmm.
Don't underestimate the power of listening. Do not underestimate the power of what I would call as empathy. Do not underestimate the power of compassion. These are very simple principles, and each of one of us can play the role. It's not the therapist out there. You are the therapist, and I'm the therapist. If we can bring those core components, and that's what Friendship Bench did. Instead of 12 psychiatrists providing intervention, entire nation became a therapist.
Yeah.
All right, and now that's been replicated in so many countries now. So for me, what is exciting about New Zealand and about this conversation, I'm delighted, Greg, we are having this conversation and you asked me this question, because eMental Health is nothing else but, to me, is a virtual friendship bench. That's what it is. Through digital technology, we need to learn to listen, yes, empathize, and have compassion. And it's power of personalization. That's what it's all about. Let's keep it simple.
That's an absolutely beautiful way to round out our interview here. I really appreciate you taking the time to be here with us on eHealth TV, and all the very, very best for the future of eMental Health in New Zealand. And I'm sure it's in great, safe hands with your work.
Wonderful. Delighted to be here, Greg.
Thank you very much for joining us. This is Greg Ward here for eHealth TV with Professor Anil Thapliyal around eMental Health.